All right, to wrap up the lymphatic system, because this one's relatively short, we're going to get into the anatomy of the lymphatic vessels and organs, right? So we're going to do all this together. We're going to talk about lymphatic vessel structure and function, and then talk about the pattern of lymphatic drainage. It's not going to be symmetrical on each side. It's going to be a little bit wonky. So we look at, in general, the lymphatic capillaries. You see how they're interwoven with the blood vessel capillaries. And so again, this is because at the capillary beds, we're going to be losing some fluid there as we do exchanges. And so it's important that we have lymphatic capillaries right there along with them to pull up that extra fluid as it's coming out of the bloodstream. If we look at how they're structured, right, we have these this endothelium, very, very thin, very small, just like our capillaries in the blood cells or in the blood vessels are. And we see these like what we call endothelial flaps, right? We can pull fluid in through them, and then we also have valves to prevent backflow. Very similar to veins. Some of their structure is very similar to the veins. If we look at the overview of where we find these vessels, I'm going to point some out. Don't mind this poor woman looking a little green here, a little sickly. We're just going to go ahead and get into it. So we're going to start at the cistern or chyli right here, which is like this large kind of swelling right above the intestines. We have the thoracic duct, right, which is moving up from there. Right, we have all sorts of lymph nodes, like inguinal nodes. Again, they're mainly named for their location, so like inguinal nodes, axillary nodes, right? They're named for where we find them. But if we look at where, as we come up, where we connect back to the bloodstream, so we can dump this fluid back into the bloodstream, right? We have, when we look at the subclavian veins, right and left, I'm going to go on the right first. We see the right lymphatic duct, right, the right subclavian trunk, the right jugular trunk. So the right subclavian trunk, the right jugular trunk lead in to the right lymphatic duct, which goes right into that right subclavian vein. On the left side, left subclavian trunk, left jugular trunk, and then the thoracic duct, right, into the left subclavian drain. This is where the naming is like, so like the trunks have names that make sense, but the ducts, right, that enter into the bloodstream, lymphatic duct and thoracic duct, those names don't really have anything to remember them by. I don't really have a trick for remembering those particular ones. Now, sometimes the lymphatic system does not function correctly, and this is a problem that can develop in response to that. This is called lymphedema. This basically, because remember, when you're pumping blood throughout, it's going through your capillaries, you are losing fluid through those capillaries. That fluid ends up in your tissues. When your lymphatic system functions normally, your lymphatic system absorbs that fluid no problem, you never notice. But sometimes there's an issue where those lymphatic ducts or those lymphatic vessels are not functioning properly, meaning fluid starts to accumulate in the tissues. So here in this one, if we look over the left at stage 1, we see this person has maybe a slight difference between each of their arms, but for the most part it looks the same. As we progress to stage 2, we see that their left arm has become a bit more swollen. There's a noticeable difference, right, if we're looking at them side by side. As we get to stage 3, we can see that the left arm is definitely larger than the right. You can see it in the elbow and the wrist and the fingers. And then when we get to stage 4, we can see there's a very significant swelling in that left arm to the point where this person may not be able to properly use this limb. In some cases with lymphedema, the fluid can actually seep through the skin, and so it can actually leak. There have been some recent discoveries with the lymphatic system as well, mainly talking about the dural lymphatic vessels. So there are actually vessels that will go up into the dura mater to link us the lymphatic system with the brain. So we see like these little lymphatic vessels in the dura mater, right in that upper side, in that periosteal dura mater, right? We see those. Now let's go ahead and move on to lymphatic organs and tissues. For this, we're going to look at the primary and secondary lymphatic organs, and then we'll talk about where we find lymphoid tissues as well. Remember, the lymphoid tissues are going to help with like the production of things like lymphocytes, whereas the lymphatic organs will be involved in the production, but they'll also be involved in filtering blood. So bone marrow is one of those, one of these lymphatic organs. If we take a peek here, we see some bone marrow that's been removed. We see the red bone marrow, which will be responsible for producing blood cells, and then the yellow bone marrow, which contains fat. Right, and then we see the periosteum all the way around it. But this, because we are producing blood cells, including lymphocytes, right, we can call this a lymphatic organ. I'm not going to spend a lot of time on this slide because we've had this one up before, but just to remind you that bone marrow is responsible for producing blood cells of all types, right, including the white blood cells and specifically the lymphocytes. So extremely important that your bone marrow functions properly and that it has these stem cells that will allow you to produce all the different types of blood cells you need, especially those involved with your immune system. The next organ is the thymus. The thymus is an organ that sits right on top, basically right just above the heart. The thymus is responsible for maturing like T cells, like the lymphocytes. It tends to be larger as a child, like when you're a kid, and then as you get older, it will shrink down. But if we take a look at it, right, we see these like pockets, right, and these little things that kind of edge in. So everything in like this darker pink is the cortex, and then the light pink in the middle, there's the medulla. And we have these little like trabeculae that come down, and we can find blood vessels inside of those trabeculae. Again, this is going to be where we are going to mature things like T cells. Sometimes the immune system does not function properly, and this can lead to what's called an autoimmune disorder. An autoimmune disorder is basically a disorder where your own immune system is attacking your tissues. So there's a miscommunication or a misunderstanding of self from non-self. There's a laundry list. We're going to go through a few of them. There's a laundry list of different autoimmune disorders that are out there. So things like rheumatoid arthritis, which we see in figure A here, the x-rays of the hands, this is going to attack the joints. And so it leads to deformities within the joints, in particular in the hands and the feet. It leads to a lot of stiffness of these and pain in these joints. We also have lupus, which we see in figure B. Lupus has a lot of different things, or a lot of different symptoms and signs, including fever, photosensitivity, ulcers, aches, arthritis, inflammation. They get like a butterfly-shaped rash across the face. They may not be hungry. They may be fatigued. They may have poor circulation. It's very much a systemic issue with lupus. So here's just a short list of autoimmune diseases. I'm just going to go through them really quickly. With celiac disease, this basically we cannot consume things that have like gluten in them, and this causes damage to the small intestines. Basically, the body's like reacting to things, including like the gluten that someone may eat in like wheat or whatever. And so someone with celiac cannot, like, they have to avoid that. It's not like a choice. It's like they have to avoid that to avoid having flare-ups and more damage being caused to the small intestine. Type 1 diabetes is also autoimmune. This is where the immune system is going to attack the beta cells in the pancreas that produce insulin. And so this means this person is not going to be able to produce insulin the way they need, and they're going to have trouble regulating their blood glucose levels. We also have Graves and Hashimoto's. Both of these are going to affect the thyroid, but with Graves' disease, this is going to target the thyroid stimulating hormone receptor, which leads to hyperthyroidism, where the thyroid then overproduces and overacts. This can lead to issues with like insomnia, losing weight unexpectedly, anxiety, and then in some cases can lead to what's called a thyroid storm, which is a life-threatening emergency. Hashimoto's, the thyroid stimulating hormone receptor is also like the target, but we're going to mimic the hormone. And so this case we have hypothyroidism, and because it's hypothyroidism, the thyroid is underproducing, underacting. And so this way you're not producing the hormones that you need. And so this is basically going to make your metabolism slow down. So this person would experience things like weight gain, even though they're not doing anything that would normally cause weight gain. They may be cold, they may have skin problems, a laundry list of issues with both hyper and hypothyroidism. With lupus, this is basically attacking nuclear DNA and proteins, so this is systemic. This is something that affects many body systems. Myasthenia gravis, this is where acetylcholine receptors are the subject of attack, and so this leads to muscle weakness because the receptors cannot, if they're damaged, they cannot respond to acetylcholine, which means we cannot tell the muscle to contract. And then rheumatoid arthritis, this will attack the joint capsule antigens, like joint capsules in synovial joints, and so this leads to chronic inflammation and damage to the joints. And in the case of RA, can lead to deformities of the hands and the feet. All right, next one is the lymph node. The lymph node, we have tons of these all throughout in different regions, like in the inguinal region. We have them, in your axillary, your armpit region. You may have noticed these getting like swollen if you feel sick, but they all have the same basic structure, right? In that we have lymph flowing in. We have B and T cells, right, packed in here, macrophages, plasma cells, where we can like filter things out. We also have like germinal centers for producing things like B and T cells, so things can flow through. It's kind of like almost like I want to say like a reservoir, but kind of like a reservoir for lymphocytes, for white blood cells. And so we can kind of clear up lymph as it flows through. We do again have the valves to prevent lymph from flowing backwards. We also get to the spleen. The spleen is kind of hiding right up there by the stomach kind of area. This is going to have two different types of pulp, red pulp and white pulp. And again, one of its main jobs is to filter the blood. The reason why we call it red pulp and white pulp, so the red pulp is mainly going to be filled with blood, right? Hence the name red. Like we have a lot of like cavities, basically like these big venous sinuses in there that are going to be filled with blood. And then the white pulp is mainly going to be white blood cells, right? That can help filter out any debris and pathogens that may come through. So you can kind of think of the spleen as like a filter as well as a reservoir for blood. With the tonsils, we have a few different pairs of tonsils. I'm going to point out a few of them. Starting up here. So the ones you're probably familiar with are your palatine tonsils because they're kind of close to your palate. These are the ones that you see when they're swollen. Like if you look in the back of your throat and you're like, oh man, I must be sick or I have strep or whatever, right? You see they're swollen to maybe white patches or whatever. Those are your palatine tonsils that you specifically are seeing. You also have a pharyngeal tonsil, which again is way up, kind of like in the nasopharynx, kind of where your nasal cavity goes back towards your throat. And then you have the lingual tonsil, which is like right down at the base of your tongue, right, way down there. So again, the only one that you really have probably ever noticed is your palatine tonsils, and these are typically in pairs, right? Sometimes people do get their palatine tonsils removed if they are constantly swelling, like if there's a problem with them repeatedly getting swollen to the point of, maybe pain or blocking the throat. If we take a peek at the palatine tonsil, right, there are all these little crypts. These are like little like openings, little folds and whatnot. But if we look deep in here, we see germinal centers, and that's where we can mature things like lymphocytes. And then lastly, we get to the mucosa-associated lymphoid tissue, or MALT. In this case, we're looking at the Peyer's patches. These are going to be associated with the digestive system. So the Peyer's patches that we see here in this picture, these are associated with the small intestine, and so this is going to help when you consume food and all that kind of stuff. This is going to help deal with pathogens that may be coming in through your digestive system.